Here's an ultrasound that was performed in a patient with right upper quadrant pain. And you can see the gallbladder right here, and then within the neck of the gallbladder there's this curvilinear echogenic structure with posterior acoustic shadowing, and so that's diagnostic for a gallstone. Now the reason I'm showing this particular case is because this patient ended up having a CT scan as well, and here you can see the gallbladder, but the gallstone is not very well appreciated on CT, and that's because the gallstone itself is isodense to the bile. This particularly happens in cholesterol gallstones, and so the sensitivity of CT in being able to assess for gallstones can be quite low, especially for cholesterol gallstones. It does a much better job in calcified gallstones, and those are not difficult to see by CT scan, but you can get large gallstones within the gallbladder and not be able to see them on CT scans. Now, the gallbladder is good to be assessed by CT for a number of reasons. One, you can look for acute cholecystitis. You can look for hyperemia involving the area around the gallbladder. You can see gallbladder wall distension, gallbladder wall thickening, and then you can also see emphysematous cholecystitis and gangrenous cholecystitis. So those are good things to be able to use CT to be able to assess, but the actual ability to be able to look for gallstones is limited on CT scan. MRI does a pretty good job as well of being able to identify gallstones, especially on the fluid sensitive sequences like T2 weighted images. So ultrasound and MRI are great at being able to assess for gallstones, but CT is more limited in being able to assess them.